Well, I guess I'd like to state that, you know, I'm finally getting to stand up here and announce something we've all been waiting for, and that is that we received vaccine this morning. We received the Pfizer vaccine, which is 975 doses. And we have also received 1,500 doses of the Moderna vaccine. Dr. Laney and team met this morning to discuss the vaccine. We've reviewed the data, and we do feel as though it is safe. And we are, you know, certainly encouraging everyone here to get the vaccine. We will be rolling out vaccine starting tomorrow afternoon. We will start slowly so that we can work out our processes. We will again vaccinate the following day, Wednesday. We will have a bit of time through the holiday where vaccinations will not be being administered. We will restart vaccination just after Christmas. So this is a wonderful day. I was going to wear my spring mask with baseballs on it just to say that looking forward to the opening day of baseball season, because that would be a happy time. I do want to let everyone know, however, that does not mean that masks will be going away. We here at Mosaic will be wearing masks through all of the upcoming year, most likely, and probably well into the future. One thing we have noticed, we are seeing very little influenza to date. That does not mean that we will not see an outbreak of influenza here over the next couple of months. However, traditionally we would be seeing more cases, and we are not. So obviously the masks, the hand hygiene, certainly would appear to be doing their job when it comes to that. So masks are here. Continue to wash your hands, continually to socially distance, and continue to be thoughtful whenever you're going out to engage in the public, whether you're going to the store or even when you're going to be out with friends. The vaccinations will start with all frontline caregivers again starting tomorrow. What does that mean? That means nurses. That means environmental services, those folks that clean those rooms. That means our cafeteria workers that go up on the floors, okay, and hand out trays. That also means our doctors and also those that work and meet the public face-to-face and access. So we will start that way tomorrow. We are starting sign up. We do have to stair-step this from a standpoint of this vaccine does have some mild side effects. Some can be a little more moderate, so we don't want everyone per se in one area to receive the vaccine all on the same day, just in case they do have side effects and they might have to take a day off of work. So we are working to coordinate this logistically. We've had teams working on this for months, and I am very happy with the processes that they have put in place. So with that, I also want to state that the mask mandate certainly appears to be helping. Our numbers have dropped. We are down here in St. Joe in the low 50s. And in fact, even for a day, we had dropped into 49 briefly. Maryville and Albany continue to have some COVID patients in their facilities. So with that, what kind of questions would you like to ask?
Isn't this earlier than you initially thought you would get the vaccine?
When we certainly have wondered, near the end of last week, it certainly started to look as though we would be receiving vaccine early this week. We were expecting it tomorrow. We received notification yesterday afternoon that vaccine was on the way, and it showed up this morning, I believe, a little after 7 a.m. The Pfizer did, and McKesson delivered to the pharmacy shortly after that, the Moderna.
Is this the amount of vaccine that you thought you would get?
This is the amount that we ordered.
Okay.
So we will, all those vaccines will be given. That is dose one. We will receive an equal amount based on the time frame allotted. The Pfizer vaccine is given in 2 doses, one now, one 21 days later. The Moderna vaccine is given one 28 days later. Okay? We will start with one of the vaccines, most likely the Pfizer vaccine will be the one that we start with first. Once we have administered all of those, we will move to the Moderna vaccine and administer those to our caregivers, and we will also be working with those independent providers that are on our medical staff that do provide care here, and their employees that come here to the hospital to assist them, such as in surgery. We will be working to coordinate that they get vaccinated also. This is the Tier 1 healthcare workers, and then those over 75 or in a living institution such as a nursing home, skilled facility, or some type of residential facility. The vaccinations of those living in those entities will be coordinated through pharmacies that the state and the federal government have contracted with. We are not doing those vaccinations unless called upon to by the state and asked to provide those services. But presently that is being done through coordination with a local pharmacy here.
How many doses do you hope to do per day in this first round?
Tomorrow we hope to do around 40 doses, roughly, maybe a few more. The following day we will do well over 100. Our expectation is that we will be doing a couple of hundred a day at least. It really depends on sign up. Right now, the majority of our caregivers have said that they want the vaccine, okay? But it's based on sign up, availability. We will be coordinating variable times so that we make sure that we are available for those folks to make sure that we get them vaccinated. Yes.
How many, I know that in the past we have heard, 10 days or a vaccine needs to be administered in 10 days. What is that timeline to where the deadline is that where you'd have to administer these vaccines that you have received?
Whenever they said that, that's kind of what they've asked is that we try to administer all vaccine in 10 days. The one thing that they didn't take into consideration is it's coming to us right before Christmas and through a New Year's holiday. So with that, we do believe that that window of time is really closer to 2 weeks. But these next couple of days, we will be working out some of the systems. We've never done a mass immunization such as this to this degree. We do influenza shots every year. We have it down to a science, but we do those in our clinics. We have drive-up clinics. This is different. Well, we're trying to immunize a whole workforce, but try to coordinate it so that folks can receive their vaccine, so that if they do have some mild symptoms, they can take care of that, but make sure we don't, injure our ability to make sure that we are able to provide care to those that we care for.
Dr. Turner, this is a virus that has killed nearly 8,000 people or not killed, but it's affected everyone's life. You guys have been in here day in and day out since day one. What did it feel like walking into work today, knowing it was here?
Knowing that it was quite a joyous time. You can actually feel the energy as you're walking in the building as people were finding out that the vaccine had arrived. There's a lot of hope, and there's also eagerness to start vaccination. Our initial plan, since we didn't anticipate getting this till Tuesday, was to start vaccination on Wednesday. But since we did get the vaccine so early today, that's why we are able to start vaccinating tomorrow. And as you said, 8,000 lives have been lost. I'm believing you're speaking to the state of Missouri. Just here in our system, 149 people have passed away due to COVID between our facility, Maryville, and Albany.
Is this an early Christmas present?
I would say it's an early Christmas present, yes.
Was it quite emotional today?
I can feel it palpable in there, so I would say yes. People are eager. It is an emotional time to have the opportunity to be able to start vaccinating those, because even though they're still wearing masks, just the fact that it'll enable our workforce to be there for the public. They pitched in, they've worked so hard, so tirelessly, pulling extra shifts, that just knowing that this vaccine, which is about 95% effective, is here, and after the second dose, within about 7 days is when it has that 95% effectiveness. The other thing that we found is that we initially thought you needed to have a delay between if you had COVID to when you could receive the vaccine. The data does indicate that if you have had COVID but you have recovered, they are encouraging vaccine for those individuals. So there were a lot of folks that had it. They were worried, gee, will I not be able to get the vaccine? We will be working with them based on what their need is, what their other risks are, but it does appear that the vaccine is recommended for them also.
For your employees that have had the virus, I heard that you guys are going to do a 3-month waiting period for those who haven't had it yet. Is that still accurate?
Not completely. Now, for those that are at high risk, we will, if they are outside their window of time, it doesn't have to be the full 90 days, we will be allowing them to get vaccinated.
Do you have an idea of when Maryville and Albany may start receiving doses?
Tomorrow. We have all the vaccine here. We will take it to them, and they will start vaccinating also. It is quite a coordinated effort.
So for people and healthcare providers outside of the Mosaic system, I know Northwest Health was testing a lot of people and had people on the front lines. Will any people outside of Mosaic employees be receiving it in this first allotment of doses?
Oh, there will be independent providers that were not able to sign up to receive vaccine. And if they weren't, we will be coordinating with them. I know the health department is also coordinating with them to make sure that they receive vaccine if they meet the criteria set forth by the CDC and the state.
We've had a lot of questions. Some people are wondering why a hospital like Atchison, which is a smaller community than ours, happened to get the vaccine before we did. Has anyone given you any kind of explanation for why that might be, or have you heard anything on that front?
Well, they're in a different state. Atchison's in Kansas. As the vaccines were arrived at the state and then set up for distribution, that's very much state dependent. So if they got it last week, I'm happy for them. I know that a couple of the hospitals in Nebraska that we keep in touch with, they receive vaccine. It just happens to be when it was arriving. Yes, it's been a week since vaccine came into the state, but it's only been a week. I have been in contact with a few of those facilities, and they are having a good response, and their caregivers are doing very well post-vaccination.
You said that you're going to get vaccinated. Are you getting vaccinated tomorrow, and will this be public?
I believe tomorrow I will also receive the vaccine, but not before we start with the frontline caregivers. And you'll have to talk to Joey about whether or not it's going to be publicized.
It's public. You'll be invited.
Dr. Turney, you mentioned staff a couple of times, and I think we had a report that Mosaic was one of the care systems getting help from. Is it Vizient staffing? Could you tell us about how much you're using, how you're accessing,
Okay.
what?
So the state, along with the MHA, engaged with Vizient, which is a agency firm that can help supply some staffing needs. If you need staffing, okay, then you can reach out to them and they can help source that staff and agency. We have been very fortunate that with our own caregivers and some of the other agency staffing companies that we had been working with, we had actually been able to bring in agency staffing to meet our need prior to Vizient being able to provide that. So we have not taken any staff from them, not because we won't if we need it, but because we at this time did not need it, and we felt as though it seemed much more reasonable for those hospital systems in other parts of Missouri that need that staff go there. Because we felt as though we had the staff to provide the high quality care that we provide and take care of our patients with who we had here. And certainly in those facilities where maybe they have less staff and more need, we didn't feel as though we should be taking that extra staff from them when we felt adequately taken care of.
So you're within the Vizient, the network that can use it, but you haven't had to use it.
We have not had to use any of those. We
But it's
did,
available if you need it.
it's available if we need it.
Is there a reason that we're doing Pfizer first and then Moderna?
Whenever you coordinate, the Pfizer is given, there's a couple of reasons. One is because the Pfizer vaccine was the first one that actually received EUA, number one. Number two, it's given, the second dose is given within 21 days. So what we want to do is we don't want these to overlap from the standpoint of, you want to take out human error. So if we're mixing both Pfizer and Moderna, they don't mix exactly the same. The amount that you administer, i.e. the volume in the syringe, is different. You want to take human error out of that, so we will do Pfizer first. Once we use up all of those, then we will move to Moderna.
How are they being stored in the hospital?
The Pfizer is in a freezer that goes to -80 or -90 degrees. We have that freezer here. We have one in Maryville and we have one in Albany. So there should be no concerns about transport or being able to take care of this vaccine. The Moderna vaccine is kept in a freezer at -20.
I know that you said the Pfizer is 21 days and Moderna is 28. Do those need to be given on the exact date as soon as 21 rolls around? Is that when the second dose needs to be given, or is there a little bit of wiggle room?
There's a little bit of a window. It's not to be given before the 21 days, but it's okay to be given a little after. So yes, you do have a little bit of window of time based on the data we had. And we will be receiving that second round of vaccine, I would believe, in about 2 weeks. The vaccine we have today, we do not save any of it back. Everyone is to be administered to the folks in the first round. Then we will receive the same amount here in 2 to 3 weeks of those. And if you received Pfizer for your first dose, you will get Pfizer for your second dose. And if you receive Moderna for your first dose, you will get Moderna for your second dose.
You mentioned hospitalizations. What do you make of the moderation of hospitalization numbers?
Here recently,
Yes.
I think it's because I believe that when the cities stood up and really made a firm stance about masks and committed to say, masks are really what we want to do, wear your mask, socially distance, be responsible so that we don't have to close down. I also know that those numbers going up certainly got the community's attention. The communities around us, it got their attention, and I believe that they've started to institute those policies, and that has helped to curb many of our infections. We also have 2 experimental drugs that received EUA, experimental use authorization, that we have been administering to those high-risk patients for admission on an outpatient basis. That was started, and we have given over a couple of hundred doses now, I believe, in our infusion area, and those medications are also being given at Maryville and Albany when appropriate.
Good? Okay, thank you all.